Welcome to the introductory video for the Inherited Coagulopathy and Hemoglobinopathy Information Portal Patient Home Module, or iCHIP PHM. This video will give you a quick overview of the system and help get you started in using it. Access the application by typing www.ichip.ca in your browser. This application has been developed for British Columbians with coagulopathies and their caregivers. It was created to help with reporting infusion records, reporting bleeds, communicating with clinic staff, maintaining records of care, empowering patients in their health care, and to conduct research with consent or as permitted by law. Information that is entered by patients in the PHM is integrated into the iCHIP clinical module. The clinical module is used by your healthcare team to record your care information. So let's get started. Click the Enter button to log in. To start using the PHM, you require your username and password, which you received from your clinic staff or the iCHIP team. If at any time you forget your password, you can use the Forgot Password link to retrieve it. On your first login, you will be sent a text message with a verification code. Enter that code on this verification page to complete your login. If you do not have a cell phone, please contact your clinic for access. You are asked to identify whether you are on a public network, such as at a coffee shop or the library, or whether you are on a private network, such as your home or the office. If you are on a public network, this access will expire after 1 hour. If you return to the same coffee shop tomorrow, you will be required to repeat this verification step. If you are on a private network, iCHIP will remember your access for 1 year. This verification step is required any time you change IP addresses, such as when you access the module from a different location, or if you make changes to your internet setup. If you are a parent or caregiver who has access to multiple patients, you will see a list of the patient accounts you can choose to access. If an order of factor product has been shipped to you, you will be asked if the product has been picked up. If you select yes, the product will be added to your inventory. If you select no, you will be asked about pickup at your next login. And this is the Patient Home module. We've made this application user-friendly and think you'll find it pretty easy to navigate. This is the main page, and it is organized into 3 areas. The main area is the submissions area. Depending on the different treatment protocols you have, your clinic staff will set up your PHM account to see only the tiles applicable to your care. Some of you will see 2, 3, or even 4 different tiles. Below the submission area is the information area. From here, you can access past bleed and infusion records. Along the left is the sidebar. If you are a user with access to only your own account, your welcome greeting will look a little bit different. You will see your name, and there will not be a link to change patients. When you have access to multiple patients, you do not have to log out of the PHM in order to change patients. Just click on the Change Patient link. From the main page, you can see if you have any pending notifications or alerts. Notifications are messages from the clinic staff to you. Alerts are automatically generated when a specific threshold is passed during your submission. Alerts are sent to both you and the staff and are visible in the PHM. Some alerts may also be received by email. When you have an alert or notification, you will see a number beside the alert or notification icons. Click on the notification or alert to view. Clicking on the Help will open up the Help section in a new tab. This includes a lot of very useful information, including the terms of use and privacy. Please be sure to read through this information carefully. The tiles in the submission area allow you to submit records on your infusions, your bleeds, and any product you have discarded. This information will be seen by your clinic staff, so there will be no more need to manually keep records to send to your healthcare team. Clicking on the bleed tile will allow you to enter information on a bleed you are experiencing. Any time you need to get back to the submissions page, select the Home button located in the top right corner. If you are uncertain about an item on the page, click the question mark in the corner. This will display help for that specific page. The help box can be moved around the page, so it won't be in your way. When entering your bleed information, there are a series of pages to fill out: product, bleed, and other info. The last page is a summary page where you can review your entry before you officially submit it. You can also go directly to the summary page and enter all your information at once. If you picked up product while traveling out of province or out of country, you can still report your submission by clicking out of province or out of country. All fields with an asterisk are mandatory and must be filled in. When you enter a submission, a list of your current inventory is shown. From the product page, select the product infused and enter the number of vials used. If you are entering more than one lot number, the infused button must be clicked before you enter another one. To enter the date and time of the infusion, click the calendar. Select the proper month, day, and time, and click OK. If you have a reaction to the infusion, record it in the Reaction to Infused Product area. To advance to the next page, select Next at the bottom of the page or click on the tab at the top of the screen. Go directly to the summary page by either clicking on the Summary button at the bottom of each individual page or by clicking on the Summary tab at the top of the Bleed menu. On the Bleed page, enter the details of your bleed. Select Yes or No to indicate if this infusion is for the same bleed that you have treated within the past 7 days. Use the drop-down to indicate how long you have been bleeding. Indicate if this bleed is the primary reason for this infusion. Select the site of the bleed and the side of the body that it's on. Select the cause of the bleed. Extra notes can be added in the Details area. If you are entering more than one bleed site related to this infusion, click Done to complete the first bleed, and then select Add another bleed. To advance to the next page, select Next at the bottom of the page, or click on the tab at the top of the screen. On the Other Info page, report your symptoms and treatments. Choose the severity of each symptom, mild, medium, or severe, for each symptom that you experienced. Select the treatments you use to manage the bleed. To advance to the next page, select Next at the bottom of the page or go directly to the Summary page by clicking on the Summary tab at the top of the Bleed menu. Review the Summary page and confirm the details, and then click Submit. A submission is not saved until the Submit button is clicked, and you will receive a confirmation. A bleed infusion can be entered directly into the summary screen. This screen has all the same fields from the Product, Bleed, and Other Info tabs. If you leave a page without completing it, the system will let you know and ask you to confirm. Prophylaxis, discards, and immune tolerance induction protocols, or ITI, are all handled in a similar way. From the main page, click on the Prophylaxis tile to enter information for a prophylactic treatment. Entering prophylactic treatments, discards, and ITI requires a lot less information than entering a bleed. The product information, including the lot number, the number of vials, and the date and time, are required, as well as any reaction to an infusion, if applicable. Entering a discard allows you to record information about product you have had to dispose of from your home inventory and why that was necessary. Select a reason for the discard. If the reason for your discard is not there, choose Other and enter a note in the note area at the bottom of the page. Now that your infusion records are entered, the infusion area on the main page will allow you to access all of your previously entered information. In past submissions, you can view and edit all of the submissions you have made. Select the infusion you wish to edit and go to the area to change. Select a line to edit or click New to enter additional information. You can sort lists by using the arrows at the top of the columns. Remember, nothing is saved until the Save button is clicked. In past bleeds, you can view just the bleeds entered, but there is no editing allowed on this page. To edit, you will have to go to Past Submissions. Inventory contains lot numbers and quantities of inventory that you have at home. It is uploaded automatically into the PHM after you indicate that you've picked up the product. There is no need for you to write down any more lot numbers to keep your records. You can run reports based on the information you've put into the PHM. Here, you can access your bleed report. This is a history of your bleed entries by site and day. Your log report has a full history of your infusions. Your utilization report shows a comparison of bleed and prophylactic infusions. Your treatment protocols can be printed so you can keep a copy with you. Reports are available in different formats, including PDF, Excel, and text. In the Clinical Information tile, you can enter and view your vaccinations and allergies. The Personal Information tile contains your personal contact information, as well as the contact information for your family, friends, and healthcare providers. You can add and edit the information that you have entered. If something was entered by your care provider, it can only be edited by your care provider. From the Password page, you can edit your secret recovery question and answer and change your password. When you've finished accessing the module, please use the Logout button to exit the application. We hope you have found this video helpful and you'll take advantage of the benefits that the iCHIP Patient Home module has to offer. For more information or to provide your comments, please contact the iCHIP team at iCHIP@pbco.ca.